in research. And just to let you know that this webinar will be recorded. So just for everyone who's in on the call. So we might get started just as people start to come in and join us. Thanks, everyone. Firstly, I'd like to start by acknowledging the Palawa people, the traditional owners of La Truita, Tasmania, whose land I'm privileged to be on today in beautiful Nipaluna, Hobart. I pay respect to the Palawa people and thank their elders past and present, and acknowledge their deep connection with the land, sea and sky country that spans millennia. I recognise that sovereignty has never been ceded and that we're privileged to be here on their country. I'd also like to acknowledge and extend a warm welcome to any other First Nations people from around Australia who may be joining us on the webinar today. Okay, so what will we be covering in this Getting Started with Consumer and Community Involvement with Research webinar? Well, firstly, we're going to understand a little bit about why consumer and community involvement is important, define some of the key terms involved that we might hear around, look at different ways of involving and different levels of involvement. And then we've got some fantastic guest speakers with us here today. I'm going to take a quick tour of co-design with Dr. Suzie Waddingham. And then we're going to dive into a case study on bowel cancer research in rural Tasmania with researcher Nicola Gadd and consumer representatives Celia Ralston and Sally Kriel. And I'd really like to thank and acknowledge Celia and Sally in particular, who are generously sharing their lived experience with us today of bowel cancer and providing their perspective on what motivates them to be involved in research. So firstly, for those of you who don't know me, my name is Kerry and I'm the Consumer and Community Involvement Coordinator at the Tasmanian Collaboration for Health Improvement. And the Tasmanian Collaboration for Health Improvement is a joint initiative between the University of Tasmania College of Health and Medicine, the Department of Health, Primary Health Tasmania and Health Consumers Tasmania. And the collaboration is an emerging research translation. It's the only one of its kind here in Tasmania. And our role is about supporting translational research and building connections between consumers, community members, clinicians and researchers, and consumer and community involvement as a really important and integral part of that process. Okay, so now let's have a little bit of a look at why consumer and community involvement is important. Well, there's a growing evidence base around the value of and importance of consumer and community involvement. And institutions such as the National Health and Medical Research Council, the NHMRC, and the Medical Research Future Fund are increasingly recognising the importance of community and consumer involvement in health-related research. In Australia, consumers are both the recipients and funders of healthcare and have a fundamental right to be involved in the research process. You've probably all heard the term, nothing about us without us. They provide researchers in consumer and community involvement really with an alternative view and help to uncover where there might be some gaps or unconscious biases in the research design. Consumers are able to provide valuable insights and an alternative view. And their direct lived experience provides real knowledge of their community and those connections to it. So the consumers and community members are really then allows research to be better aligned to the needs of the consumers, the community members, and ultimately what that helps to support is that research then can be translated into practice. So they're just some of the reasons why consumer and community involvement in research is really important. So again, let's have a little bit of a look about the context and some of these key terms. In Australia, the National Health and Medical Research Council, the NHMRC, provides guidelines for involving consumers and community and members in research. And this statement, which is, you see the little green book up there on the side on consumer and community involvement in health and medical research, is one of the key documents that guides research institutions, researchers, consumers and community members in the active involvement of consumers and community. So how do we define consumers then? Well, consumers are people who have a lived experience of a health issue. They might receive healthcare or advice or otherwise use healthcare services. It's important to also know that this includes patients, their friends, families, carers and members of the general public. So essentially, we could all be considered to be health consumers. We also sometimes hear the term used, consumer representative, and this term is used to refer to people who actually represent the views and interests of a consumer organisation, a community group or a wider organisation. And later on, we're going to hear from some consumer representatives who are involved in Nicola's project. So again, it's also important to define community. So often we think of community really as people who share a geographic location, but in this context, in consumer and community involvement, community can also be people who share a common interest around cultural, social, or health conditions. And it's really important that we connect with different communities, as different communities will bring different approaches and perspectives to their involvement in research. So there's also often some confusion about what consumer and community involvement is. And the terms consultation, participation, and engagement are often used interchangeably. So really, what is then consumer and community involvement in research? Well, consumer and community involvement in research is about research being carried out with or by consumer and community members rather than to, about, or for them. And this is when consumers and community members actively work with researchers and research organisations to help shape those decisions and research priorities and putting policy into practice. So it's really important to remember that consumer involvement's not just a tick the box or tokenistic exercise, but really what we're wanting to do is to engage consumers and community members in a really genuine and meaningful collaboration. So that's how we define consumer and community involvement. And it's also important then to just clear up some of the confusion which often occurs around whether or not consumer and community involvement and being a researcher, being a participant in a research trial is the same thing. So as a participant, the researcher might collect data from the people or in the cohort in the study. They might also be collecting blood samples and or taking part in a drug trial. So this is not what we define as consumer and community involvement. So participation is seen as a separate exercise. Also, when we are going out, so say, for example, speaking with consumers and community members in providing information in a town hall or one-way information, this isn't also how we define consumer and community involvement. So while these are also all really important aspects potentially of research, it's not how we define consumer and community involvement. And then, so going back to what we were talking about, that's really about that genuine and meaningful collaboration across the research team. Okay, so let's talk a little bit then about some of the steps as this is getting started with consumer and community involvement. What are some of the steps that we might go through when planning for consumer and community involvement in research? So research is often visualised as a cycle when we're deciding what to research, deciding how to do it, undertaking the research, and then letting people know about the results before deciding on the next steps. The researchers in the room might think, if only it was that easy. And also consider when is it that we should involve consumers and community members in our research? Well, really getting people on board early in research is considered to be best practice. But involvement can really happen across all stages of the research cycle, from setting priorities right through into implementing and even communicating the findings back to the community. And we'll hear some of that sort of process from Nicola and Celia in their presentation as we go along. The other really important aspect of planning for consumer and community involvement is we need to consider what role consumer and community members might take in the research itself. So how can the lived experience of your consumer and community members input into the research design? Consumer roles may take on an advisory function, or they could really be embedded within the research process. So we're going to have a little bit of a look here just at some of those different roles that consumer and community members might take. Consumer and community members could be involved in community conversations or co-design processes. And that could be taking the form of perhaps informing on research topics or providing relevant information, inputting into co-design of education materials and the like. Consumers can also be involved as document reviewers. And so they're providing then feedback on research ideas, information sheets that might be going to patients or participants, and even inputting into event materials. Another form that consumers can be involved is as research buddies. This is particularly relevant to researchers who are doing lab-based work and might not have strong connections or ability to link with the community. So consumers in this context are able to then meet with those researchers and provide that real link back to interpreting data. We can also then, as I mentioned, really embed consumers and community members within the research team. So they could be involved as associate or chief investigators. The other aspect that consumers and community members can be involved in is around governance, both in research itself, in the research governance teams, and also within the research institutions. So they could be involved as consumer and community members on advisory groups. They could be part of a broader stakeholder group that brings together researchers, clinicians and other members of perhaps of government organisations and sit on steering committees. They can also be then involved, really embedded at that higher level in terms of the governance structure of the research institute itself. So really, there's just a list to start off thinking about some of the different ways that consumers and community members might be involved in a research project. And when selecting roles, it's important to go back to that consideration that they should be meaningful and really genuinely contribute to the research process. So this slide here is another important tool for helping us to plan for consumer and community involvement. So it's also really important not just to consider what the role might be, but also at what level will consumers and community be involved in the research. So this table here shows a spectrum, which is the International Association of Engagement IAP2 public participation spectrum, which is often also used, and this one here that is depicted is particularly used in the research context. Many of you may have used it in other engagement work that you've done. On the left of the spectrum, we see what's considered sort of the lower levels of involvement around informing or consulting with consumers. In the centre, we see where we're truly involving and collaborating with consumers. And up on the far right of the spectrum is the highest level, where research is actually being led by consumers and community members who are empowered to take on that research. So why do we use this tool, and why is it important for us to understand? Well, as you can see, at each level, it indicates a commitment or a promise to deliver on the expectations around that involvement. So what we want to really avoid is misunderstanding around the expectations for each level of involvement. For example, if consumers are collaborating in research, the expectation is that consumers will be included as partners, and their contributions will really be considered and actually influence the research. So we want to make sure that we're aligning those expectations with that level of involvement, and that everyone knows what's involved when they're working on a project together. One of the things that could be important to consider really is, are we actually able to deliver on the promise made at this level of involvement? So some of the considerations there are around resourcing. Do we have some funds in our budget for remunerating and involving consumers? Are there any geographic considerations that might prohibit consumers perhaps from travelling to being involved at a very high level? So really what we want to do is to assess this in our planning stage and make sure that everyone understands the roles and expectations on both sides. So now I would like to hand over to Dr. Suzie Waddingham, and I'm just wanting to check that Suzie is in on the call. Is Suzie here, has joined us, Philip?
Susie's looks like she's unavailable.
Okay, all right. Well, thank you. Sorry to hear that Suzie is unavailable to join us on the call today. So what we'll do is, oh, there she is.
No,
She's
here
just
she comes.
popping in now. So that was perfect timing there from Suzie. And I'll just give her a minute to get in on the call. Hi there, Suzie. I'll just give you a minute to get in on the call and introduce you. So I'd like to hand over to Dr. Suzie Waddingham. Suzie is a lecturer at the School of Medicine and a researcher. Suzie is also a seasoned practitioner of participatory research methods, really embedding the community voice within the research process. And Suzie is going to take us through a really super quick tour today of co-design. And following Suzie's presentation, we're then going to hear from Nicola and Celia about a Bowel Cancer Research project. So I'll hand over to you, Suzie, and just let me know when you're ready for each of the next slides.
Thank you, Kerry, and thank you for everybody. I'm really sorry that I'm just coming in the nick of time. I've come from another presentation, so which was all about participatory action research. So we're all on the same page. So you've already covered a lot of, why community and consumer involvement is important, and that is the same reasons on why it is important in co-design. So co-design in itself is a transformative community-centred design method, which a lot of people use this terminology, but it's rarely practiced in a genuine way. It's a system that listens to people with lived experience. And it's really important that people understand that this is an iterative and participatory process. It is not a one-off event. It is very much embedding people with lived experience, the community and consumers in the co-design, in the process of design. It brings people together, and there is a shared power among researchers, professionals, community, lived experience to explore issues, design solutions, and improve health outcomes. There is also a focus on building capability or confidence within the community and capacity. There's a very big emphasis on empowerment, and this will come with the shared power and the acknowledgement that people there joining us when we're designing, joining us as experts. Then they're not joining us as the experts, they're joining us as being the experts. And it can be combined with exploratory research also. It's designing the design at or for people, where it's like, you know, patient-centered or human-centered, is where the designer is still in control. Designing with people or led by the people is where there's an element of handover of power and control to those who will be impacted by the decisions. So that's where this shared power comes in, that what they have to say is really important, and we need to listen to that. And that's about bringing in local context. It's not about dismissing current evidence, which a lot of the professionals and research have. It's about embedding that with the community's lead, where they want to go. Okay, next slide, please. So if you think about co-design as having three important elements, McKercher strongly believes that you need to see co-design as a movement. It's a way of being that is normal. Everyone should be doing this, basically. That is what it's saying. It's a mindset and it's a method. So those three pillars are really important elements to bring together co-design, and you need to have all of those three. Next slide, Kerry. So with the movement side of co-design, it's about really slowing down to listen to what people are saying, connect and learn from local consumers and community, and embed their participation into everyday practice. They are not there as a tag along or to tick a box or to have a one-off and say, okay, we're done now. They're very much there as part of a participatory approach to learn and listen from them. So there are a range of different approaches that fall under this banner. One that I'm involved in at the moment is using a design thinking, which is very much about embedding and listening to those along each step of the way. And if we go to the next slide, it's also very much in alignment with participatory approaches and action research. So all of these are often connected. So if you're using co-design, you're often using participatory practice and action research, or you could be, there's also participatory action research is another form. They're going to have elements of co-design. It can be a standalone, but it should never, from action research, but it should never be a standalone from a participatory approach. So here's a nice little quote from Jackson and Greenlaw. Rather than, here is one I've cooked earlier, now eat it, researchers may increasingly say, here's a kitchen, let's choose the ingredients and the method, make the meal, sample it and refine it together and shoot for MasterChef. So when you think about this, it's a classic that a guideline or an intervention is put in place and then people need to come to the party. What this is talking about is actually bringing people to the party first and listening, designing together, working out what's going to work. The researcher can facilitate this process by drawing on current evidence, so we know that we're using what things do work and what they don't. If it's something new and how we can evaluate it, but we're doing it all in the same kitchen together. Okay, next slide. So it's important to also look at what co-design is not. This is used a lot, the word co-design. There's a lot of different other terms used for it as well. And like co-creation, co-production, although co-production is a little different. And it's what it is a quick fix. It's not done in isolation with one person who's got great ideas about what is going to fix a community and off they go. It's not a one-off consultation or a one-off event. It is not low-cost research where you are bringing people into the room and not resourcing them adequately. And Kerry, I'm sure, has covered that in the CCI and adequate reimbursement for people's time as being experts. No decision-making power is not part of co-design. There is decision-making power. So that's a bit confusing how I've written that, but not listening to what the community and people with lived experience are saying. You can have them in the room, but it's important to also listen to what they're saying and act on what they're saying as well. I know that people who have been brought along to meetings or workshops feel like they say something and they're dismissed or they're not heard. And creating something in isolation to community and people with lived experience, that is not co-design. And I've just come from a workshop actually where, there was a conversation about, doing things collectively in an action research approach. And when I asked, well, where are the people with lived experience or who's part of the project at the end of the day, and no, they are not in the room. So it's important, whether you've got, time restraints, then you build this in. It's really about practice and culture. Once you start doing it and you understand it, then it will just become normal. And I believe that is my last slide. So I'm not sure if we wanted to have any questions at this point, Kerry, or if we're going to wait to the end.
Thank you, Suzie. I think we're going to wait to the end and see if there's anything that comes up in the Q&A if we've got time. But thank you for that fantastic overview of co-design and really some of the key elements around making sure that consumers and community members have a voice in that process. So thank you for that, Suzie. That was terrific. So now I'm going to introduce you to our guest speakers who are actually putting co-design into practice in a bowel cancer research study here in rural Tasmania. So in a moment, I'll stop sharing and I'll introduce you to Nicola Gadd. I was fortunate to meet Nicola, a University of Tasmania PhD candidate at the Centre for Rural Health earlier on last year, and be able to provide some input into CCI planning for her project. And we also have Celia, I mentioned before, Ralston joining us. Celia's a community member who was involved in the project all the way through. And Celia is a really powerful advocate for bowel cancer prevention and education and early detection. And we're going to hear from her as well about how she got involved with the project. So I'm going to stop sharing. Just bear with us a moment as Nicola gets her slides up, and then she's going to take us through information about the Bowel Cancer Research Project. Thanks, Nicola. Handing over to you. You're on mute still, Nicola. There we go.
Can you hear me?
Yep.
Yes.
All right. All right. Can you see my slides okay?
Yes.
Yes.
All right. So thanks, Kerry and Suzie. So hi, everyone. My name is Nicola, and this is also Celia. I've got to come and join us today, and she's a community member involved in my project, like Kerry has mentioned. So today I'm going to discuss the research project and the journey of involving community members. And then I'm going to finish off with asking Celia about her experience with this project, just so that you can hear the perspective of a community member involved in research. And so this project is a co-design approach, and it's with the Centre for Rural Health, and it's funded by Cancer Council Tasmania. So I'll start off with a bit of an overview of the project. So the aim of the project is to co-design an education strategy that's aimed to improve bowel cancer awareness and encourage people to do the screening in rural Tasmania. So to do this, we started off with a literature review that was aimed to help identify what education strategies have been done before and whether they've worked or not. We've then done a qualitative study, which we did in 2 parts. So we started off with interviews, and they were with the community members to help identify what are the barriers and the enablers to doing bowel cancer screening, but also to look for information about bowel cancer. We then moved on to the second part of the qualitative study, which was the group workshops. And this is where we did the co-designing with the community to develop the education strategy. So we plan on, after all of this is finished, to actually pilot the education strategy within rural Tassie to see if it's actually effective. So both the literature review and the interviews, these parts were to really help inform the co-design process. And where we're at now is we're actually developing the education strategy components with the community. So along the way, we've also involved bowel cancer consumers in a document review level. And this was to help make the interviews and the workshop content easier to understand. So we worked with the Tasmanian Collaboration for Health Improvement to be able to do this. And they helped to connect us with the different cancer consumer groups, like we connected with Health Consumers Tas and Cancer Voices Australia. So the consumers that helped with our project were those with either a lived experience of bowel cancer or those who had completed the bowel cancer screening before. And the activities that we had consumers provide feedback on were the interview guide questions and the workshop content for our first workshop that we did. And so we had 3 consumers provide feedback on the interview questions. So this was looking at the plain language of the questions and the overall structure of the interview. And they helped to alter wording and also remove any questions that didn't quite seem to fit. And this was really so that we could make sure that the questions that we're asking in the interviews were actually going to be easy to understand by the participants. So we also did had the consumers provide feedback on the workshop content. So this was really because the group workshops where we're doing the co-design of the education strategy with the community. So we really wanted the community members who are participating in the workshops to be able to understand this information that we've collected up till now about bowel cancer, so that they can then be informed with their creation. And we again wanted to receive feedback on the plain language of the content that we were presenting to the community. So who was involved in the co-design? Well, as I mentioned before, the co-design was in the qualitative study in 2 parts. So the interviews and then the group workshops. So for the interview phase, we conducted interviews with rural community members. And then for the group workshops, we asked those that participated in the interviews if they'd like to stay on board and be involved in the group workshops. We also asked other rural community members if they would like to join, and also opened it up to rural healthcare providers like GPs and the pharmacists and the practice manager at the GP. And we also had the researchers in there as well. So the reason for this is that by doing a co-design, we allowed it to be both evidence-based and community informed. So for the group workshops, the community members and the health providers, they're the ones that really drove the designing process of the education strategies. And as researchers, we just helped to answer any questions that they had and also guided the workshop activities that we did. So the co-design, so each step of the project really helped to develop the next. And for example, the interview findings, they were what influenced the first workshop. So how we had found from the interviews, what are the barriers to doing bowel cancer screening? We listed all of those and printed that off and put it up on the wall in the first workshop. And then what we did was we asked the participants to each put a sticker next to the ones that they thought were most important to focus on. And so then the top 3 barriers to screening identified by those participants were then what they focused on to develop the education strategies around. So then from that first group workshop, they'd come away with some strategies, and then the second workshop built on that and further refined the strategies they'd created. So by using the 2 workshops, we were able to allow the community really to have that time to refine the education. So what strategies did the community design? So they developed a local media campaign where they suggested we really just need to advertise everywhere in the town. But this campaign also should run twice a year and align with other campaigns like the breast and the bone buses that come to this rural community. So the components within the media campaign they came up with were to have flyers and include those flyers within the newsletter that they've got within that community, have signs around the town, post social media posts on their local social media pages that they've suggested, and to also create a video involving the local community members. So another part of the education strategy they had decided on was to create a community education event, so have a few events around the town that have involved personal experiences and clinical facts. And to do this, we combined the community champions, so those are people with lived experience of bowel cancer, and also have them with health professionals like the GPs or the pharmacists within the rural community, both presenting and educating community members in community events. So after we completed the 2 group workshops, we asked participants if they'd actually like to stay involved in the project. And this was so that they could help with the developing of the education strategies. So they'd no longer be participants involved in designing the education strategies. They're now helping to actually put them into place and develop these research materials that they've come up with. So what we have got the community members to do is to provide some advice, feedback or support on different things like, so far we've got help with the video. So we've got some of those community members have actually stayed involved and done interviews for the videos, or they've recommended other people they think would be useful for the video. They're going to provide some feedback on the media materials that we're creating. And we've also got other suggestions that we're going to come up with. Along the way, we're going to reach back out to these community members that want to stay involved and let them know when we've got other ideas or when we're working on the next stages to help out with. So really, by giving the community this opportunity to be staying involved in the project, we can ensure that the education strategies remain as intended by the community. All right, so now I'm going to stop sharing my slides so you can see Celia and we can hear from her perspective. All right. All right, so Celia, thank you again for coming and joining us today.
Thanks, Nicola.
So I've got 3 questions that I'd like to ask. So the first one is, why did you want to be involved in the research?
My decision to be involved was because this is very personal for me. My father died from bowel cancer, as did my paternal grandmother and aunt. My sister has celiac disease, and my 2 most recent colonoscopies revealed polyps, which have been removed.
Thank you. So my next question I have for you is, what was it like to be involved in the co-design?
It's been one of the most empowering processes I've undertaken. I've had several ideas over the years around how people can be better educated and directed to screening and testing. But as a community member, I felt there was no outlet or ability to engage with the healthcare system to put my ideas forward.
Yeah, okay. And the last question I have for you is, how do you think the consumer's voice has helped to shape the education strategies that were developed in those co-design workshops?
As a consumer with family experience, I was able to bring real practical knowledge to the table, the good and bad around screening, diagnosis, treatment, and ultimately death in our family situation. Healthcare providers and researchers understand the problem from a scientific, medical and statistical viewpoint, put all these viewpoints together, and I believe the education strategy we developed is groundbreaking and potentially life-changing. I think in summary, I would like my continued involvement to facilitate clear messaging around screening and early diagnosis leading to good outcomes. Whilst it was my father who died from bowel cancer, the impact on our family was unimaginable, and I hope to provide the human side of the process.
Thank you for that, Celia.
Thanks.
It's been really nice to have you join us and stay involved from the whole process. Like, you're actually involved in each stage that we had for the qualitative study. So it's been really good to be able to work with the community and hear from your perspectives. And it's also really nice to hear that you've actually enjoyed this process and actually been able to get something out of it.
Yes,
so,
definitely. Thank you.
Yeah. Just a final point I think I just want to make is that from doing this research, it's made it really quite clear that you can't just assume what the community want. Like, we're developing an education strategy. If we want to know what to include, we really do need to speak with people like yourself, Celia, and actually hear the perspectives of those that are going to be impacted by this. So thank you. And
Thanks.
Kerry, I'll hand it back to you.
Thank you so much, Celia and Nicola, for that fantastic presentation. And as you said, it was just really, really valuable to hear how your research was involved and the consumer and community members right the way throughout. So just as our sort of in our final 15 minutes, we have got one more consumer member that we'd like to hear from, and this is Sally Kriel, who was also involved in Nicola's project earlier on in the document review process that Nicola had mentioned. Sally is a consumer representative from Cancer Voices Australia, and she also has a lived experience of bowel cancer. Sally has established a cancer support hub called Awaken Mama Wellness, and she's also a clinical nurse, consultant, consumer advocate and author, and actually based in Queensland. Now, unfortunately, Sally wasn't able to join us on the call today. However, we have recorded a video with her, and the full transcript is available on our website. And we're going to play just 5 minutes of that video where Sally talks to us about what motivated her to be involved in Nicola's project, and some things for researchers to consider when partnering with people with lived experience. So if you just bear with me, everyone, for a moment, I'm going to share my screen and play the video before we wrap up and then take any questions at the end.
The work that I did with Nicola, basically anything that I see coming through Cancer Voices Australia that comes to me, which talks about improving timely diagnosis for bowel cancer patients, which talks about how we can improve patient outcomes, and which talks about improving quality of care. Those are all of the things that I look for as a consumer. And I also look for any projects where we talk about more broadly across the cancer space, improving patient outcomes. So Nicola's project definitely fitted that category. And in particular, I have a strong interest in looking at patient resources. And when I do that, I look through the eyes of the consumer and also through the eyes of the clinician. So making sure those two areas meet, and that we're conveying information really well, and also how a consumer would receive that information. I know myself that when I will write patient resources, sometimes it still does have that clinical lens over the top, overlaid. So taking a step back and looking at through the eyes of the consumer is really important. And Nicola's work, which does look at how we can improve timely diagnosis, which will impact treatment outcomes, is an incredible piece of work. So there was no question that I didn't want to be involved with her project.
What makes it easier or more possible for consumers and community members to be able to contribute? What are some of the things that might support that to happen?
I think, and that's a really great question. And I love that we're seeing the consumer partnership emerging, and it's a lot stronger, I would say, in the last 5 years than it has been previously, which has been fantastic. But I guess engaging consumers early on, so in that design phase, is really important, and seeing the consumer as a partner rather than an optional addition or something that we need to do as part of a tick box process. And I say that with all due respect, but I do see that as a consumer in different areas and also as a clinician. So really thinking about how you co-design with a consumer is really important. Timely communication, being very clear on what you want from the consumer is so important. And like you would treat any member of the team. So I often say to clinicians and teams, treat your person with lived experience, your clinician, as someone that is as valuable as your other team members. We want to know why and what. So essentially, why is your research, why is your project so important? How is this going to improve the patient cohort that I represent? So how is this going to improve the health, the clinical outcomes, the patient journey? How is this going to help our patient population? And keeping in mind that the person with lived experience or the consumer can also be a carer or a loved one. It's not always the person involved, and that's quite important because we do get different perspectives from the person with lived experience and from the carer or the loved one as well. I guess those are the main sorts of things, making sure that your call to action is really clear. What do you want from us? How can we best support you? And tapping into the platform like we've talked about with Cancer Voices Australia, because then you can ask for particular, I guess, qualities or experience in a consumer, and that's quite important. I'm really fortunate enough that through my online platform work that I am doing now and that I've done previously, I've been able to connect with a whole range of cancer patients from across the country. So I know the types of questions and the types of issues and gaps that those patients are experiencing and facing. So if you want a breadth of experience, do put that in your proposal request. Don't be afraid to ask, because people will have different ideas. And if you are looking at an intervention, of course, that involves an older age group, then you do want to have a consumer that has that experience. Equally, the younger patients or mothers or fathers, just be very clear on what it is that you need.
Thank you very much to Sally. As I said, it was terrific to hear from her, and we're really grateful that she was able to record an interview with us today, and that will be available on our website to see the full recording of that. So now we'll just check in and see whether or not we have any questions in the chat. I don't see any there at the moment. We've got just a few minutes left if anyone does want to put any questions in the chat. Meanwhile, while we're just wrapping up, I'd like to really thank all of our panelists today, Celia, Nicola and Suzie, for sharing so generously with us. And at the end, in a moment, I'm going to just share a final slide, which gives you some information about how to join as a member, if you'd like to, for the Tasmanian Collaboration for Health Improvement, to stay in touch with our newsletter and upcoming events. So this was really just an introduction around getting started with consumer and community involvement today. Obviously, there's a lot more to talk about, and upcoming in September, Suzie and Mary-Louise Bird will also be presenting more on participatory ways of involving consumers and community, including methods like co-design. Suzie, I'm just wondering if you want to make any concluding statements before I share the final slide.
No, I thought that was fabulous, and I love having Celia and Sally on the webinar, because they're the people who are really going to drive the change in translational research. So thank you, Celia. And we are looking forward to showing different ways that people can be involved going forward.
Absolutely. Thank you so much for that, Suzie, and great remarks. And I've just got one question there in terms of someone was interested in how Celia got to be involved in the project. And I might open that up to you, Nicola and Celia, to respond to that one.
Yes. Celia, do you want to start up?
Look, I'm quite happy to. It was really quite clear. I was seeing Nicola in her dietitian capacity, and we started talking about other health issues, and then I think that sort of led to the fact that I had this issue with bowel cancer in my family. And when she had the questions there to speak to people, and she was starting to gather that information together, it was fairly seamless. She asked if I would be interested in being involved.
Fantastic. Thank you, and terrific to have you've been so involved in all stages of the project. So we've got a bunch of questions coming in now, so we might just continue to answer a few while we've just got a few more moments here. So we've got a question that says, 2 questions. 1, can you talk through about the ethics processes and were there any sticking points that emerged? So that's a big question, and again, I think it would be interesting to have a follow-up session, particularly around ethics and ethics processes. And the second part of that question is, are community and members also included on as co-authors on publications? So I might just hand that one over to you, Nicola, as I'm not sure if you've done your publishing yet, but we'll be looking to in the near future.
Yeah, we are looking to publish a few papers from the qualitative study. We plan on it doing about 3 from the interviews and the group workshops. That's sort of where we're sitting at the moment. I haven't gone too far with looking at doing co-authorship, but I certainly know that Sally, the consumer who hasn't been able to make it today, she has co-authored projects. I know that she certainly sent me along some papers that she's done, so it certainly is possible. I think, Suzie, you'd probably have a better knowledge of this because, yeah, this is my first co-design process. So, yeah, on this particular project, it hasn't got to that point yet.
Yeah, just to answer number 1, it's a great question, and it's one that is often asked. I guess the way I look at explaining it is that you think about it in sort of 3 ways. One is whether or not your consumer and community involvement are purely like, you know, peer reviewing or consultation, where you're not actually using any of the information that you talk about as far as data goes. The other one is if they are participants, where you're using a sort of a co-design, but you're actually doing research on a process. And the third one, where it's a little bit of both, where that's where I tend to have my research, is where I use a lot of action research, and I always put my consumers on my ethics application, because I'm asking them of information that I'm using as data, and I'm often testing a process as well. So I'm asking them about, you know, their thoughts about how we're doing things, how we're recruiting as we go along. My best example, I guess, is the Northwest Hypertension Project. And the way I wrote that up was presenting it as a full project, but asking for ethics in phases. And that makes it easier for the ethics groups, committees to be able to get their head around. So you ask for, you know, the first phase of where you're asking for information. And as Nick said, that there is a time in this process that she used, which is very similar to how I run my research, is that there is a point in that co-design process where you're no longer sort of collecting data from them, they're becoming consultants. So once they become purely consultants, then that's when you can still have them on the ethics application, but you're not required to get the information and consent for them to be a participant, if that makes sense. So I've got lots of examples. I'm happy to chat to anyone about that. And what I recommend is that you write your protocol and then send it to one of the chairs, HREC chairs, to be able to have a look at, and then they can raise any questions for you. I do that for all of my ethics application, because I work in this action research space, which is not as clear as some other types of research. And as far as co-authors, there is absolutely no problem with having community members as co-authors, and in a pure CCI style, that is absolutely good practice. But in a lot of action research, it is not like the main priority. It is something that we do, but the key in that output in this style of research is linking back to the community all the time and making sure that our knowledge translation is clear for that group. But there is no issue with having community members as co-authors.
Great response. Thank you, Suzie, for filling us in on all of those details. As I said, there's much more to consumer and community involvement, and of course we'd be happy to hear any thoughts and responses on things you'd like to hear more about, so feel free to send those through to us. One final question, which was just around remuneration for consumer involvement on this project, and I believe that was funded from a small grant by Cancer Council Tasmania. Have I got that correct in this instance, Nicola? Yeah. So thank you again to all of our guest speakers, and thank you to everyone for joining us on the call today, on the webinar, and being involved in the Q&A. And just as we go out, I'm going to just finally share my screen with everyone. So if you want to jump on straight away and join as a member of the collaboration, there's a QR code for you there. And again, big thanks to everyone, and really terrific to have you on the webinar today. So I'll just jump back in. So that final slide there just shows you a link then to join the collaboration, stay in touch with us, and find out about events and news that we have coming up. So again, thank you to everyone, and thank you to our great guest speakers for sharing their experiences of consumer and community involvement and co-design in particular with us today. Thanks, everyone.
Thank you.
think I might save the chat because I think we've got lots of questions maybe still floating around in there. I can follow up for next time. Right on time. There we go. Let's see if there's any other questions in there that missed.
Did you want us to
Yeah.
stay on, Kerry?
No, I think I'm just checking there. I think all those questions have been answered, and I know